I am Noreen, your nurse for today. So for today, I will be assessing your genitalia. So it is necessary to do an assessment of the female genitalia for us to be able to see any presence of parasites and for any signs of inflammation, swelling, and lesions. So for this assessment, I am asking for your 100% cooperation. So do you wish to have someone with you here while I'm doing the assessment?
No, I'm comfortable enough for this assessment.
Okay, so before we start, I will first perform hand hygiene and I will apply gloves for infection prevention and close the door for your privacy. Okay, so now ma'am, I am going to ask you some questions if you have any history of the following. So in what age have you had your first menstruation?
I had my first menstruation when I was 12 years old.
Okay, so is it regular or irregular?
It's regular.
Is the flow heavy, moderate, or light?
During my first and second day of period, it's heavy and then it will become moderate.
Okay, so how long does it usually last?
It lasts for about 5 to 6 days.
Do you experience any cramps before or during your period?
Yes, during my first and second day of period.
Okay, so do you have any problem with the intercourse?
No.
Do you experience pain during your intercourse?
No.
So do you have any unusual discharge?
Yes, there's a white discharge.
Okay, so have you been pregnant?
Yes,
How many times?
2 times.
So how many children do you have?
I have 2 children.
Okay, so is there any complications during your labor or delivery?
No.
Okay, so how often do you urinate at night?
I think 2 times.
Okay, so do you experience pain while urinating?
No.
Do you experience having difficulty to urinate?
No.
Okay, so do you have any past history of sexually transmitted disease?
No.
Okay, so now I am going to cover your pelvic area with this sheet. And after that, I'm going to assist you to a supine position with your feet elevated on the stirrups of this examination table. And after that, I'm going to assist you to a dorsal recumbent position with your knees flexed and your thighs externally rotated. So now, I am done with steps 1 to 5. Now I'm going to use this drawing for steps 6 to 8. I am now going to inspect the distribution, amount, and characteristic of the pubic hair. So I can see that it is generally kinky and is distributed in the shape of an inverse triangle. And for any abnormal deviations, I will see a scant pubic hair, which indicates hormonal problem. Now I'm going to inspect the skin of the pubic area for any presence of parasites, and for any signs of inflammation, swelling, and lesions. And to assess the pubic skin adequately, I'm going to separate the labia minora and the labia majora. So I can see that the pubic skin is intact with no lesions, and I can see that the skin of the vulva area is slightly darker than the rest of the body, and the labia is round, full, and relatively symmetric. And for any abnormal deviations, I will see a presence of lice, lesions, scars, fissures, swelling, excoriations, varicosities, or leukoplakia. So now I am going to inspect the clitoris, urethral orifice, and vaginal orifice. And now I'm going to separate the labia minora and the labia majora. So I can see that the clitoris does not exceed from 1 cm in width and 2 cm in length, which is normal. And I can see that the urethral orifice appears a small slit and is the same color as the surrounding tissues, with no signs of inflammation, swelling, and discharge. And for any abnormal deviations, I will see a presence of lesions. So now, I am going to palpate the inguinal lymph nodes using the pad of my fingers in a rotary motion. Okay, so now I am going to palpate your inguinal lymph nodes using the pads of my fingers in a rotary motion. Okay, so I can see that there is no enlargement and no tenderness. And for any abnormal deviations, I will see a presence of enlargement and tenderness. Okay, ma'am, so we're done with this assessment. I am now going to document the findings in your record. Thank you for your cooperation, ma'am.